Bhagavi ma'am, can we start? Shall we start? Ma'am, can you hear?
So is Bhargavi ma'am trying to say something? I couldn't hear. Was
As it, yeah, I can hear you now. Can you hear?
I can't hear Bhargavi
Aprajit,
ma'am. It's like yes, ma'am. I can hear you.
you can hear me, yeah. You can hear me, right?
Yes, I can. Can everyone else hear me?
I can
Yes,
hear you.
ma'am,
I
both
think
are
hopefully it
good.
will be, I think. Okay, thank you. So, Jisna,
Yes, ma'am.
So am I good
Jisna
to start?
will start. Aprajit, she will introduce and okay. Bhagavi ma'am, yeah, Jisna, over to you.
Okay, ma'am.
Okay, yeah.
Good morning, everyone.
Jisna, over to you.
Yes, I am Jishna Madhu, first year MTech student of Biomedical Department. On behalf of the Biomedical Department, I welcome all for the last day session of STTP. For the morning session, we have Aparajit Sahai with us. He completed his bachelor degree in Biomedical Department from SRM University and master degree in Biomedical Department from University of Toronto. He worked as an associate medical device consultant at Ironstone Product Development Toronto from year 2017 to 18. From year 18 to 20, he worked in Flosonics Medical Toronto as a quality engineer, and currently he is working as a QARA manager at Flosonics Medical. Audience, kindly post your questions in the chat box. Your queries will be answered at the end of the session, and I request all the participants to mute their mics. I would now request Aparajit Sahai sir to take over the session. Welcome, sir.
Thank you for that introduction, Jishna, and thank you everyone for having me. And we're going to be talking about international standards and third-party testing today. This is, at least in my opinion, this is likely the most interesting part of medical device development. Some people think I'm crazy for liking international standards because they're dense, but I think that's just me. But third-party testing is definitely a very interesting part of medical device development. You get to see a lot of cool things. For example, we're going to be talking about 60601-1. There's specific things that are tested which are fun, like the drop test. Dropping a silver ball on the device to see if you know uh, it creates any unacceptable risks and such. Piercing batteries with nails. Your lithium-ion batteries are certified to 62133. So one of the tests in that is to pierce the battery with a nail. Another one is to drop a huge weight on it to see if it blows up. So there is a lot of cool stuff that happens in third-party testing. But at the end of the day, the most important thing about these standards in third-party testing uh, is that they ensure that your device is safe. International standards are created so that they give manufacturers a uniform framework for what they need to do in order to make the device safe, and what they need to do to make sure that in the case of failure, in specific cases of failure, the device can still continue performing as intended without compromising the safety of the patient or causing any unacceptable risk to the patient. So I'm going to skip over the introduction because I think Jishna gave a very good introduction. So I'm going to be talking about the basic structure of standards first, because it's very important to understand that basic structure, because unless you understand the basic structure, it's difficult to really read the standard correctly and really find what you're looking for. And then we're going to go over specific standards which are very important. Of course, I can't cover all the standards. There are hundreds and hundreds of standards. But I'm going to try and cover some of the major ones that might be relevant to you when you graduate and you go into a QA/RA kind of role. So yeah, let's start with the basic structure of standards. Essentially, the most important part. These are the most important parts, barring the last one. Technical reports is something separate that I'm going to discuss briefly in a little bit. But you have a scope, normative references, terms and definitions, normative text, and appendices. I'm going to share a standard that I have open right now. Can everyone see the 10993-1 on my screen? Can you see the standard on my screen? I just want to confirm before I start. Awesome. So okay, let's go over. So as you can see, the scope basically tells you what this standard is applicable to, and what essentially where you can apply the standard and where you can't apply the standard. And this is critical because there are times when if the scope doesn't apply to your device, you may not need to comply with it. And there may be specific things that you can exclude if they're not in the scope. The scope is critical. It tells you where the standard is applicable, where it isn't applicable. Normative references, not as important, but they're important in the sense that they tell you where things have been picked up and placed in the standard, the standards they've referred to. So as you can see, there are a whole bunch that are mentioned here. 10993-3, 4, 5, 6, there's I think up to 18. Yeah, up to 18 in this case. But there are also, you can also see the risk management standard referred to here. So it's, this section basically tells you other standards they've referred to, and it provides you, sometimes you may need to you may want to refer to other standards. So this is a good guide as to what other standards you may need to refer to. Now comes one of the most important parts is the terms and definitions. I mean, essentially, when you read a standard, you need to understand what each term means. And I don't mean the dictionary definition. What I mean here is the definition that's in this standard. Because how the standard applies to you will be determined a lot by how specific terms are defined in the standard. So these terms are very, very important, and you need to understand these well in order to be able to apply the standard, understand the standard and apply it to your device and determine what kind of test. So that's the terms and definitions. Now we come to the normative text, which is the meat of the standard, where they have specific tests described, they have requirements described, and so essentially the meat of the standard is here. But the scope and normative references, and terms and definitions are critical for you to understand before you can apply, before you can understand the normative text part of the standard, where the specific information that is important to testing is present. So that's basic. That's kind of the basic structure of the standard. And there are, a lot of standards have these flowcharts that are very helpful in determining requirements for testing and such. And then comes another very important part of the standard, which is, so I mean, at the end, I keep saying everything is important, and it is. Everything in the standard is important. The annexes essentially explain why certain requirements are in the standard, or how to comply or how to test. So annexes will give you guidance as to how to apply the standard. So if you're ever confused about something, you're not being able to understand something in the normative text, look into the annexes. The annexes will have more information as to what you need to do. Particularly for this standard, we can talk about this a little later. We're going to talk about it. This standard, this table here, I'll rotate it so that everyone can look at it. This table is critical to the standard. 10993, this table determines exactly what testing you need to do based on the category, the type of contact and the contact duration. So anyways, that takes care of the basic structure of the standard. And then there are technical reports. So for example, ISO 14971, which is the risk management standard, has a technical report that goes with it, which is 24971. And essentially what the technical report does is in addition to the annexes, it explains how the standard can be applied and how you can comply with the standard. So there you can find technical reports not just for 14971, there are technical reports for 60601-1, if I'm correct, and also for 13485. So these technical reports explain to you how you can apply the standard. They don't really lay out the requirements. The requirements are in the actual IEC ISO standards. They're not in the technical reports. But the technical reports that go with specific standards, they explain how to apply those standards. So that's about it for the basic structure. It is very important. If you don't understand anything about the basic structure, feel free to send me questions, because unless you get this right, it's very difficult to apply the standard correctly. So starting with the first standard, we have ISO 13485, which is the quality management system standard. Of course, it's not a it's a voluntary standard. You don't need to comply with it. What you really need to do is meet the quality systems regulations in the specific jurisdiction. For example, in the US, it's 21 CFR 820. So you need to meet those regulatory requirements. What ISO 13485 does is essentially it provides a standard that can help you meet the regulatory requirements. And in fact, if you have access to the standard, you'll read that it is essentially made so that manufacturers can use the standard to meet the regulatory requirements without having to think a whole lot about the specific regulations. But that doesn't mean that you don't go in and you read the regulations, because ultimately those are the things you're complying with. Compliance to this particular standard is voluntary. And within the standard, there are several clauses. I mentioned some of them here, the broad ones. For example, the general requirements. For example, if I remember correctly, you have to comply with, your quality system has to be risk-based. So that's mentioned in the general, something like that would be mentioned in the general requirements. A specific one that I can remember right now would be, you have to verify all your QMS software. Any software that you're using for quality management, you have to carry out proper verification. So to determine if the software is in fact suitable for its intended use. So that some stuff like that would be in the general requirements. Then you have management responsibility. Essentially, what management responsibility talks about is it essentially dictates that management has to be responsible and they have to provide the resources that are required for the quality team, the quality team to do its job. So management cannot neglect the quality management system. Like, it can't just be something that they do once and forget about it. Management has to be continuously involved in quality management, and the quality management team has to update management frequently about the activities that are going on in the company. If any improvements are required, if more resources are required to comply with the regulatory requirements or maintain quality. Then moving on to resource management, this talks about how you need to hire people who are competent to do specific jobs. So, for example, if you're building an ultrasound device, you can't hire someone who's an expert in, let's say, CT technology. Like that competence doesn't really match. So you need to have people who are competent in achieving specific, competent in carrying out the tasks that are required in the company. So that's essentially what resource management focuses on. There's, of course, more specific information in there, but for that, I would recommend you read the standard and send over any questions that you may have. Product realization is the meat of that standard. Like it's clause 7, has everything from product conceptualization to verification and validation. So that's product realization is really the part you should focus on from a product development perspective. Of course, all the other clauses are critical as well, but from just a pure engineering product development perspective, product realization is the one you want to focus on, and that's really the meat of the standard. Then you come to measurement, analysis, and improvement. The system and many regulations like 21 CFR 820 require that the quality management system be improved as time goes on. So that's essentially what this particular clause talks about. Now, in order for you to be able to improve, you need to be able to measure processes. You need to be able to measure something before you can determine whether it needs to be improved or not. So that's what measurement, analysis, and improvement talks about. Non-conforming product, this is always going to happen. You're going to receive bad parts. So you need to be able to track those bad parts and make sure they don't make it to controlled inventory. And when you assemble devices, they're going to be ones that don't conform to the requirements. You need to make sure that they don't get shipped out. So this basically talks about how you should be able to track non-conforming parts and make sure that you're not shipping them out to customers. Then comes a very important part, which is CAPAs, or corrective or preventive actions. So if you have non-conforming parts, you have process deviations or process non-conformances, then you can take corrective actions. You can do corrections, which are more instant, steps that you take to fix the issue, and then you have corrective actions, which can help you make sure that that particular issue doesn't come up again in the future. So you have corrective actions there, and then you have preventive actions where you see some problem developing and you fix it. Essentially, or you fix it before it becomes a problem. So you have CAPAs. Then there are other requirements in the standard, like purchase controls and such. You need to audit your suppliers, make sure that they are in fact competent to supply what you're asking them to supply, and things like that, which are important to quality. So this is a big standard. It does require training. So if you are looking to work in quality assurance, I would recommend that you take some formal training from BSI or Intertech or one of these big companies, because they provide training in these standards and they're pretty good about those trainings. So I would recommend that you go ahead and do those trainings if you do plan to work in quality assurance. Then we come to a very critical standard, and in fact, a very recent revision of this standard came out, which every time either 60601-1 or the risk management standard or 10993 get revised, and I mean major revisions, not amendments or anything, but major revisions, they do shake up the medical device world. And so the same thing with risk management, ISO 14971. The most recent revision really put focus on post-market activities. But anyways, we'll come to that. So within risk management, as the name suggests, is making sure that your device is safe, and not just your device, that you use a risk-based approach in your quality management system as well, so that you can ensure that you're not introducing risks into the device and in the company in general. So risk management doesn't just apply to the product; it also applies to the company in general. And essentially, what it tries to inculcate is a culture of risk-based thinking. If you're going to take an action, what it boils down to is, if you are going to take an action, think about the implications before you take the action, and if there are going to be harms related to that to what you've identified, then you take measures to fix them. So that's essentially what risk management is all about. So you have the intended use of the device is critical when it comes to risk management. So the intended use determines how risky your device is, whether your device is meant to just suppress a tongue, so a tongue suppressor, intended use, that would mean it's a very low risk device compared to a pacemaker or a stent, which would be a very high risk device based on its intended use. So that's it's very important. The critical part of risk management, the first step is to determine what your intended use is, and then based on that, you would basically be able to you can proceed with risk management, because then you can determine the profile of risk you're looking at. Then it comes to risk identification, identifying specific risks. Is this device going to shock the patient? Is it going to shock the operator? Is it going to fall on someone and kill someone? So specific risk identification. Then risk analysis is about determining the probability and severity of harm. So if you've identified a risk, how severe is that risk? How severe is the harm that comes from that risk, and how probable it is. So there could be a very I'd say something really dangerous, but it's very, very rare that it's going to occur. So in that case, you may not need to worry as much about it. In that case, you would work to decrease the severity of it. Probability is not that much of a problem, but there is sometimes there are like there are risks which are not as dangerous, but they're very frequent. So in that case, you want to work to decrease the frequency. And it is quite possible in specific cases that you may not be able to either decrease the probability or the severity. So when you can't decrease the severity, you decrease the probability, and when you can't decrease the probability, you decrease the severity. So and then you learn more as you read a risk file and you actually start doing risk management. When you're developing a device, you learn more then. Like I can't really teach much about the standard. This has to be done in practice for you to be successful at it. Then we come to risk mitigations. Essentially, what measures are you taking to ensure that either the probability of the harm has gone down or the severity of the harm has gone down. So that's risk mitigations. Then you come to verification of risk mitigations, making sure that the risk mitigations that you've implemented are in fact working. They are working as intended, and they are in fact either decreasing the probability of a risk or the severity of a risk. Now we come to residual risk. It's quite possible sometimes that you may not be able to remove a risk completely, and that is totally acceptable. But you need to inform the user about the residual risk that remains, and you need to determine whether that residual risk. I forgot to mention it here, but then you look at what's the benefit risk analysis. So as long as your benefits outweigh your risks, you should be fine. And in most cases, your benefits would need to outweigh your residual risks, because after you do risk management, after you've done your mitigations, you're left with residual risks. What's left after risk management? So residual risks, for example, let's say you're going to apply tape on someone, you're going to apply tape on someone. So one of the risks related to that tape could be that they cause an allergic reaction. Now, what you can do is you can, to mitigate that risk, you get tape that is biocompatible, and you test it, make sure that it is in fact biocompatible. But that tape still, when you apply it, it will still cause some amount of discomfort. You can't eliminate that part. So that there's still that residual risk that the patient will have irritation and minor irritation, minor discomfort. So that is a residual risk. But let's say if that tape is holding a very important tool in surgery or something. I'm just making something up here, and it's providing a benefit that far outweighs what the risk is, and in that case, that risk is considered acceptable. And this is very general. Please don't quote me on this. I'm talking in very general terms. When you do actual risk management, you have to be very specific. And I know that I've been saying this throughout yesterday and today. Post-market activities. So risk management doesn't stop once your device gets through regulatory clearance or approval. This is an activity. Risk management goes on throughout the life of the device, and when it is on the market, it's possible that you will discover new risks. It is impossible to find out all the risks before the device is commercialized, and it is possible that you will never be able to find out all the risks related to a device. You may identify new risks. when you identify new risks, you need to go through the same process of analysis, mitigation, and verification. And this goes on throughout the life of the device. Human factors, I know I touched upon this yesterday, but essentially, human factors is a process standard that tells you how to make a device usable. There are no technical requirements in there, but it does tell you a very a uniform approach to making a device usable, how to test, how to do usability testing. That's essentially what this focuses on. And it talks about how do you plan usability testing and how do you run a usability test. It talks about two specific kinds of testing, formative and summative. So formative testing is when you're in the process of developing the device. You have some prototypes that you've come up with. So let's say you're thinking about three different kinds of designs which could potentially solve the problem that you're trying to solve. You can go out to potential users, get their feedback on which of those would be most usable, which of those do they like the most, kind of thing. So that would be formative testing, and that would inform your design as it's being developed. But once your design is ready and you're ready to commercialize the design, you do summative testing to make sure that that design, in fact, meets all the marketing requirements and it is in fact usable. So that would be a final testing before which you would submit. You would submit both, but in generally for low risk devices, you would just submit the summative testing for human factors to a regulatory body. And then the one very, very important part of human factors is identification of use hazards. Like when a user is using a device, is it possible for a hazardous situation to be created? If that is true, then this standard lays out how you can identify risks using the human factors and usability engineering process. So a big part of human factors evaluation is identifying use hazards. Now we come to the behemoth, which is 60601-1, also one of the most interesting parts of medical device development. At least electromedical, like 60601-1 wouldn't apply to a whole host of devices, but my experience has been with electromedical, and I'm guessing a lot of you will also be doing electromedical. Of course, it's possible that you don't do electromedical devices, in which case this is not really applicable. But for those of you who do electromedical devices, electromechanical medical devices, this is very, very important. So it is a big standard. It is dense. It is essentially the general standard for basic safety and essential performance. I would recommend going up and reading about basic safety and essential performance, because those two are very, very critical when it comes to the standard. And it's a general standard because it has general requirements as to, let's say, for example, if you have a device that plugs into the wall, you could have 10 different devices with different applications that plug into the wall. It has requirements in there about if a device does plug into the wall, what specific requirements does it need to meet? Touch current or patient leakage current, those kinds of things. So these are all general requirements. And then you have particular standards, which you will see. Usually IC 60601-1 is general, and then you have particular standards which would be designated with 60601-1, 60601-2 whatever number. So let's say I think -27 would be your ECG standard. -51 is LEDs that are used in therapy, and then there's 22, I think, which is lasers, and then of course 37, which I work with a lot, is diagnostic ultrasound. And then there is another series of standard, which is the 80601-2 whatever number. So these particular standards are for specific kinds of technologies. You have one for X-rays, you'll have one for ultrasound, you'll have one for lasers, you'll have one for LEDs, one for ECG, ventilators. So yeah, these particular standards apply to specific kinds of technologies. So when you are developing your medical device, based on the kind of technology you're developing, you may be able to find a particular standard. But if it's something that's pretty novel, it's quite possible that there is no particular standard for that technology. And then you have collateral standards, which kind of are also general. For example, a very important collateral standard for electronic and electrical medical devices is EMC 60601-1. Sorry, 60601-1-2. That's the EMC standard, and the EMC standard lays out requirements for how your device should behave in an electromagnetic field, basically. So if you're putting your electronic or electrical medical device next to other medical devices, that device can interfere. The electromagnetic energy that it produces can interfere with other devices. The electromagnetic energy from those devices can interfere with your device. So there's immunity, which is how good how well you prevent external electromagnetic radiation from interfering with it. And then there's immunity, and I'm forgetting the other term here, but essentially it's how good your device is at not radiating electromagnetic energy that would interfere with others. So there are levels defined within the standard. There's also ESD. So a lot of times with electronic and electromedical devices, static charge can kill the device. So ESD testing is very important, and there are specific levels that you need to test at based on the application and the materials that are on the surface of the device. So collateral standards. Then there are other collateral standards like 1-6, which has to do with usability. So I'm not too sure about this, but it does seem like at some point 62366, which we just talked about, will replace 1-6 in the future. But for now, 1-6 is also has to do with usability. Then, if I remember correctly, -9 is for environmentally conscious design. Not many countries actually comply with it. Not many, jurisdictions require it. The only one jurisdiction that requires compliance with the standard is Brazil, and it's quite possible that and only Canada, I think, has actually released its own version of the standard. So there isn't really that much focus on environmentally conscious design yet, but I feel that might change in the future. And then there's -11 and -12. -11 is for home use. So if you're going to make a device for home use, what are the requirements that you need to meet? And then -12 is for EMC, for EMS, emergency medical services. So normally, if you're making a device that will be used in an ambulance or a helicopter that is carrying patients to a hospital, there are very specific requirements that they need to meet. They're like EMC, electromagnetic compatibility requirements, durable elements, vibrations, and such. So collateral standards, they're also general. They're not specific like particular standards. So again, you have the general, you have particular, and collateral standards, all that come under the 60601-1 series. Moving on to software lifecycle. Again, another it's a process standard. It has specific risk classification for software, classes A, B, and C, based on your intended use and the potential for your software to cause harm to the patient. You would classify your software. And one thing that I do want to emphasize here is 62304, their classification doesn't really match up to how the FDA classifies softwares. So be careful about that. So, and check in your jurisdiction if they have a different way of classifying medical device software, and how, like, the classes in 62304 allows you to downgrade the classes by, let's say a device is class C, you implement risk control measures. You can bring the risk class down to B and then subsequently A, hopefully, in some cases. But the FDA doesn't allow that. If you have a software that is high risk, then it will remain high risk. But of course, you have to mitigate, but in general, it will remain high risk, and that's what the FDA would want you to treat it as. You can't change it to a moderate risk. Then this one software lifecycle, it tells you what documentation